Dr. David Rawson, founder and president of this wonderful academy. This is webinar number 26. It's hard to believe we started this last September, thinking we would do one or two or three, and we're now almost up to 30. It's a great pleasure to welcome back again Dr. Sharon Morong, who was with us a few months ago, and she's been an active participant in panels we've had over the session since she spoke herself. Dr. Sharon Morong, MD, MSc, FRCSC, is an otolaryngology head and neck surgeon certified by the Royal College of Physicians and Surgeons of Canada, subspecializing in sleep medicine and sleep diagnostics. She's also a lecturer in the Department of Otolaryngology, Head and Neck Surgery at the University of Toronto. During her career, she has received numerous awards, has published multiple peer-reviewed articles and book chapters on sleep medicine and sleep surgery, and has spoken on national and international platforms about drug-induced sleep endoscopy, which is the topic she presented last time she was with us. She's now director of the Sleep Endoscopy Center for Snoring and Sleep Apnea in Canada, which is in Toronto, and you need to know that's one of only 3 services available in the whole country. Tonight, Dr. Morong is bringing us the following topic: a focus on sleep health, helping our patients optimize their sleep. Dr. Morong, welcome back.
Thank you. All right. Well, good evening to everyone. And firstly, thank you, David, for giving me the opportunity to come here to speak again today. And, you know, as sleep professionals, we are very established in treating patients when it comes to sleep apnea. But, you know, I think it's the end of 2021. We've been dealing with life during a COVID pandemic. And I think it's important to be able to take a step back and really look at why we want to optimize the sleep health for our patients. And we should be able to provide holistic care to that patient who's controlled with sleep apnea, but they're still exhausted or they're still having non-restorative sleep. And it may be that just a few basics in improving their sleep habits is all that they need. And those basics are very important for us to understand, not only for our patients, but for ourselves as well. So why do we care about sleep? Pretty much, we all know that sleep is needed for survival, right? But I think it's become more apparent in this pandemic that we not only want to survive, but we want to survive well. And good sleep is critical to that from many perspectives, from a physical health perspective, from an emotional health perspective, and a mental or cognitive health perspective. So let's take a look at the physical health features of good sleep. So when we sleep, our heart rate goes down, our blood pressure goes down. Essentially, our heart gets a chance to rest. And when we're sleep deprived, our heart is under excessive strain for an indefinite period of time, and that's not sustainable. And studies have shown that sleep deprivation is associated with an increased link of coronary heart disease, risk of dying from coronary heart disease, or risk of strokes. When we look at the metabolic side of things, when we sleep, we metabolize our fats, our sugars. And if we don't have that good sleep that we need, studies have shown that there is an increased link in associated risks of obesity, type 2 diabetes, hyperlipidemia, hypercholesterolemia. So it serves a very important role in generally making sure that our metabolic processes run smoothly. When it comes to our immune system, there was a study that was done that looked at about 164 volunteers, male and female, and they assessed their sleep over 7 days, looking at sleep duration, looking at their sleep quality with sleep diaries and sleep studies. And then pretty much after those 7 consecutive days, they administered nasal drops of rhinovirus to each of those volunteers and then monitored them for the next 5 days to see if they would develop a cold. And what they found was that volunteers who on average would sleep less than 5 hours per night pretty much developed a cold much higher or much, with an increased significance compared to volunteers who were getting more than 7 hours of sleep. So it shows that sleep is needed for our immune system to become strengthened, replenished, not only to prevent infection, but if we do get infected, that we're able to actually recover well from it. Now, when it comes to cancer, there have been more studies looking at the connection between a lack of sleep and the increased risk for developing cancer, particularly with breast cancer and prostate cancer. And there are lots of reasons why this is postulated to happen. One is that when we don't get enough sleep, we have an increase in what we call systemic inflammation in our body. And inflammation has been shown to be linked to tumor progression, tumor aggressiveness, and recurrence. We're also seeing another population of our patients that are particularly at risk, and those are our night shift workers. And night shift workers, they are chronically exposed to light, and technically they should be sleeping. And what they found is that this chronic light exposure suppresses their levels of melatonin, and melatonin, as we know, is there to promote sleepiness, but it also has another function to help stop tumor growth, help stop cancer spread. And in these night shift workers, over time, their melatonin levels are reduced. So unfortunately, it breeds an environment where cancer can grow. And they've seen so many studies linking night shift workers with these increased risks that the International Association for Research in Cancer has actually put out a statement classifying night shift work as a type 2A carcinogen. Now, looking at emotional health, our sleep is needed for regulating our mood. There is a part of our brain called the amygdala, which is responsible for processing emotion. And there is another part of our brain called the prefrontal cortex that's responsible for processing the situation that triggered that emotion. When we sleep, those two parts of the brain get a chance to work together so that ultimately we're able to look at situations within context. And it provides us with clarity, basically a balanced outlook, so that we're able to cope and be more resilient in stressful situations. Now, when we don't get sleep, those emotions that we have go unchecked. That balance is lost. So you leave yourself exposed or vulnerable to an increased risk of anxiety, irritability, depression, and studies are showing that a lack of sleep is a risk factor for suicide as well. Now, our mental, cognitive health. How does sleep affect our day-to-day performance? So during sleep, we transition from wakefulness to light sleep, to deep sleep, to dream sleep, and we go through this cycle about 4 to 5 times per night. The role of deep sleep is to strengthen and consolidate any new information that we've acquired that day. The role of REM sleep is to actually integrate that new information with information that we already know. And when we cycle continuously throughout the night, these processes are strengthened and reinforced. So we wake up with more clarity, more focus, we're better able to perform. When we don't get sleep, life becomes a bit of a fog. Being able to make thoughtful decisions, recalling old information, learning new tasks, all of these things become a challenge. And then you find yourself living in a mental state of fluctuating irritability, lackluster motivation, and ultimately it affects your performance. Unfortunately, it not only affects your performance, but it affects the performance of everyone working around you as well. So sleep is a key essential component to your performance and your team's performance as well. Now, there have been studies looking at the connection between a lack of sleep and cognitive decline. So if we look within our brain, we have a system called our glymphatic system. And the glymphatic system is responsible for eliminating toxins, clearing out waste products that we have in our brain. And some of those waste products are proteins called beta amyloid and tau proteins. Now, studies are showing more and more that this glymphatic system is activated primarily when we sleep, and particularly when we're in our deep stage of sleep. So when we don't get that sleep, instead of being able to eliminate those toxins from our brain, what happens is that those toxins start to accumulate. Now, as we get older, we see on sleep studies that the amount of deep, slow wave sleep that we get reduces or is decreased with time. And when tested, healthy older adults who seem to be sleeping fine without any concerns still show elevated levels of these waste products, beta amyloid. And the fact that this is happening is showing that it's simply because during the time that they're sleeping, there's less time to do it because there's less slow wave sleep for this process to occur. Now, this is a little bit concerning because we know that significantly elevated levels of beta amyloid and tau proteins are markers or biological markers for Alzheimer's dementia. So I think the take-home message here is that in general, sleep is needed to preserve our cognitive function by eliminating those toxins that can potentially lead to dementia. But it's even more important as we get older that we truly be intentional about getting good sleep, because the time within which we have to actually eliminate these toxins does decrease with time. So a question I get a lot is, how many hours of sleep do I need to get? And we have different organizations, primarily in the US, that have put out different recommendations. The National Sleep Foundation has put out a recommendation for 7 to 9 hours of sleep. The American Academy of Sleep Medicine has put out a recommendation for adults for 7 or more hours. I would say that these recommendations are guidelines, and they're basically guidelines for our society to abide by. But when it comes to the individual, these hours can vary. So there is no real magic number here. Basically, the number of hours you need to be able to say that this is your ideal number of hours of sleep is pretty much the number of hours that you need to consistently wake up feeling rested, feeling energized, and to be able to go about your day performing well during the day. Now, this is with the caveat that within those number of hours, you're actually getting good quality sleep. So how do we improve our sleep quality? I would say that there are two principles. One principle is circadian rhythm alignment, and the second principle is our sleep drive. So let's talk about circadian rhythm alignment. Circadian rhythm alignment is pretty much where you're trying to match your internal body clock with your environment's clock. So when it's daytime, you're awake, you're alert. When it's nighttime, you're sleepy, getting ready for bed. So there are different ways we can try to improve that alignment in our daily life. One, it starts with our wake-up time. Our wake-up time needs to be consistent. Our body thrives on structure, consistency, and that initial wake-up time is a very important cue for the rest of the day. Now, that consistency does not end with our wake-up time. We should have consistency during our daily routine as well. And that doesn't mean that every single day needs to be the same, but we should have certain time points during the day that serve as cues that are consistent. So the time that you start work, for example, or when you take your coffee break, or when you have lunch, when you exercise, these are all cues that help to reset our body clock, and they are really essential in terms of trying to get a good night's sleep. Daylight exposure, very important. We will have a lot of patients now who are working from home who may be cooped up in a basement office all day, not seeing any daylight, and their body becomes confused. Their body has no idea whether it's daytime, nighttime, when they should be awake or when they should be asleep. So they start developing problems with their sleep. We need to be intentional about this, right? Opening up curtains, allowing the daylight to come in, going outside even for 5 minutes. And, it is a bit of a problem, especially as the winter months come along and daylight exposure is harder to come by. And that's why I wanted to talk a bit about bright light therapy. Now, bright light therapy is a well-established therapy for patients who have seasonal affective disorder. Seasonal affective disorder is a disorder where a patient's mood goes down during the fall, winter months when there's less daylight, and then their mood comes back up again in the spring or summer when daylight returns. So bright light therapy works well for these patients. More and more studies are showing, though, that bright light therapy can be used for, or at least there's a potential for good use in patients who have sleeping problems. There was a systematic review that was done trying to address this question: what is the effect of light therapy on sleep problems? And in general, what they found was that light therapy is effective in treating sleep problems. And it worked best in patients who have circadian rhythm disorders or patients who have or experiencing insomnia. So I think it's worth speaking to, talking about this as an option, potential option. There are more studies that need to be done, but I think it's still a good option. Now, in terms of bright light therapy, there are different forms you can get. One is a light box. If you're purchasing a light box, it should have a light intensity of 10,000 lux. There should be no UV wavelengths coming through this product at all. It should be UV free. If a patient has a light box, they should always have it at arm's length. So if they're at their desk or if they're at their table having breakfast, it should be at arm's length and angle at 45 degrees to the face. A patient should never look directly into the light box because it's an extremely bright light, but the exposure itself can help in terms of improving daytime sleepiness and improving alertness as well. There is another form of bright light therapy that you can have. It's called a wearable. And they're pretty much glasses that you wear, and the light shines down from up above, and the light intensity is lower. It's about 2,000 lux intensity, but it is as effective. And it's very good for patients who need to be up and about and getting about their day, and they don't have time to sit in one place with a light box. Now, side effects that patients can have, possibly having headaches, eye strain can potentially happen. The best time to use this device, it would be the first thing, first thing in the morning when you wake up, typically within an hour. There are nuances based on different patients and their sleeping habits, but in general, first thing in the morning within an hour of waking up, I would say start at 15 minutes and then progress to 30 minutes of use. Now, winding down. So winding down is pretty much where you're trying to encourage your brain to get sleepy. That's where we produce and release a hormone called melatonin, which is our sleepy hormone. The primary trigger for this hormone is darkness. So when evening comes around, we should try to dim the lights that are in our environment. And just as darkness triggers melatonin, light suppresses melatonin, which we need to help us stop that process of feeling sleepy, falling asleep. So you really want to try to avoid electronics. Electronics, they emit light, they suppress melatonin, they're no good for your sleep. So if you do have to use your electronic device, what I typically say is to make sure the light intensity is extremely dim. Having a blue light filter attached is important. The caveat I would say for electronics at bedtime would be if you're using it for audio purposes. So if there's an app on your phone that produces white noise, or an app on your phone where you listen to sleep stories, those can be very, very helpful when it comes to trying to fall asleep. The next feature to look at is temperature. Temperature is another part of winding down. Our body starts to drop its core body temperature about 2 to 3 hours before bedtime. And that drop in body temperature actually signals and triggers the release of melatonin, which ultimately helps us to fall asleep. When we go to sleep, our body loses heat. And that process of losing heat allows our body to release even more melatonin, which then causes us to stay asleep. And, we've seen in a few groups of people that this may be a bit challenging to do in the elderly. The elderly, they don't lose heat as well. So they may tend to get overheated over the course of the night. Patients who may be pregnant or who are going through any stage of menopause may also have challenges with getting that core body temperature down. So here are some recommendations I often give to help with that. One is that the room temperature should be about 19 to 21 degrees Celsius. 2, avoiding humid heat. Now, heat exposure has been shown to be disruptive to sleep, to reduce REM sleep, and overall, a patient is getting very non-restorative sleep because of heat exposure. And they found that humid heat is even worse. So if a patient has a humidifier in their bedroom, I typically would recommend a cool air humidifier versus one that is warm. Exercising just before bedtime, not the best idea, just because exercising before bedtime, you are now raising or elevating your core body temperature, and you're making it a lot harder for your body to get it down to the point where melatonin can be released. So avoiding any sort of exercise within 30 to 60 minutes before bedtime is recommended. A warm bath. Warm baths are great. I'd say, usually within 1 to 2 hours of going to bed. Again, not just before bedtime. The warm bath itself is not the important part. Pretty much the warm bath is relaxing, but it's after you come out of the bath. The cooling effect that happens, that is what triggers the physiologic response within your body to set yourself up for a good night's sleep. Cooling devices. There are lots of cooling devices on the market in terms of blankets and pillows. There was an interesting study that was done looking at a forehead cooling device. And this was based on the premise that a lot of patients who have difficulty falling asleep, their thoughts are just racing. It's because there's an increased level of activity in the frontal cortex, and there's a lot of metabolism that's going on. So the brain isn't able to cool down. So they did a randomized control trial, and they had a group of patients who had this forehead cooling device for 2 nights, and they had another group of patients with a vestibular stimulating device. Neither group knew which one was the therapeutic device, and they measured sleep using questionnaires and also with sleep studies. And they did actually find that there was an improvement in the patient's ability to fall asleep using the forehead cooling device. So again, more research needed, but it was still an interesting development. Now, for patients who may not purchase this forehead cooling device, what I recommend is a cooling eye mask, or you can even bring an ice pack with a magic bag inside of it, have it next to your bedside. So if you wake up at 2 o'clock in the morning and you're overheating for any reason, placing the magic bag on your forehead may help to calm your thoughts, calm your body, and get you to fall back to sleep a bit faster. Now let's look at sleep drive, our second principle, sleep drive. Sleep drive is really our body's need to sleep, right? That feeling of sleepiness. And that sleep drive actually starts when we wake up. And it starts when we wake up because we produce a neurotransmitter called adenosine, which then slowly builds up over the course of the day, which causes our sleep drive to slowly build up over the course of the day until it reaches a threshold at night where we need to sleep. And then once we sleep, those adenosine molecules are broken down. What we need to be mindful of is pretty much, do we have certain habits during the day that may block or reduce that sleep drive that would make it more difficult for us to fall asleep at night? One of the most popular ones that we know of is caffeine, right? Caffeine is an adenosine receptor antagonist. So it blocks the receptors for adenosine. So it's a great stimulant. It improves our alertness, our focus, our performance. The question is, what does it do to our sleep? So there was a study that was done in healthy normal sleepers who would typically consume 3 or more servings of caffeine per day, or 5 or more servings per week. And what they did was they basically gave them a 400 milligram caffeine pill, either at bedtime, 3 hours before bedtime, or 6 hours before bedtime. And they did this for 4 consecutive nights. So one night they'd be administered a caffeine pill, the next night they would be administered a non-caffeinated pill. And the sleep measures that they used were basically sleep diaries and a home sleep study. So what they found was that for all of these volunteers who had caffeine administered at bedtime, 3 hours and even 6 hours prior to bedtime, they showed a reduction in their total sleep time. Patients who administered the caffeine pill 3 hours and 6 hours before, they had increased sleep latency, meaning that it took longer for them to fall asleep. And they also had a number of increased awakenings during their sleep as well. On PSG, what they found was that there was a reduction in the amount of deep restorative slow wave sleep that they were getting. So, in summary, pretty much that 400 milligram pill of caffeine taken even 6 hours before bedtime was still powerful enough to disrupt their sleep. What was interesting about this study was that when you compared what the patients, their perception of their sleep to the sleep study, patients who took the caffeine pill at bedtime or 3 hours before bedtime, they did note that their sleep was disrupted. It took longer to fall asleep. And the sleep study corroborated that. But for patients who, or volunteers, I should call them, who had the caffeine pill administered 6 hours before going to bed, they reported their sleep was fine. There was no disruption. And their sleep study, however, did show that there were more awakenings and there was a reduction in slow wave sleep. And I think this is important because I do see a lot of patients where, I'm told that they drink coffee and they seem fine. They don't think it's having any effect. So it's being, able to explain to a patient that although you may not feel the effects in that moment, that the sleep study is showing that they are getting less of that restorative sleep, which could affect them in the long term. So when I counsel patients about caffeine, pretty much I let patients know that one, the half-life of caffeine is about 5 to 6 hours. So if you are taking a cup of coffee or having a cup of coffee around 5 p.m., 6 hours later, 11 p.m., 50% of that caffeine is still running through your body. So it's no surprise if either you're not able to fall asleep well or you're not having the most restorative sleep. The best thing to do would be to, one, limit the amount of coffee you're taking to about 4 cups of coffee at max, I would say, and to have coffee no later than 2 p.m. The other thing to look out for are hidden sources of caffeine. For one, decaf still has caffeine in it. Teas, green teas, black teas, there's caffeine in that as well. The energy drink you have after a workout, there may be caffeine there. The dessert, the chocolate cake that you have after dinner, there's caffeine there. For patients who have migraines, some of the medications, the migraine medications also have caffeine. So it's just to be more mindful of where caffeine may be hidden within a patient's diet. Alcohol. So alcohol is an interesting one because lots of patients take alcohol to relax, help them to fall asleep faster. And alcohol does exactly that. It is a sedative, so it does help you to fall asleep faster. But studies have shown that it is quite disruptive to your sleep. There are more awakenings and a general reduction in particularly in your dream sleep overnight. So if you want to get good restorative sleep, the half-life of alcohol is about 4 to 5 hours. So try, if you are going to drink alcohol, not to have it within 4 to 5 hours of going to bed. Naps are very good. They're very good at helping improve your performance and focus on alertness if you can have one during the day, but you need to make sure that it does not affect your sleep drive. So limiting naps to 20 minutes, maximum 30 minutes, and not having a nap any later than 3 p.m. is recommended. Exercise. Exercise is great for balancing out sleep drive, your circadian rhythm. It helps to improve sleep quality, the continuity of your sleep. It increases deep sleep, REM sleep. So exercise is strongly recommended. The only caveat we talked about was pretty much not to exercise within 30 to 60 minutes before going to bed. So common sleep issues that typically I see in my practice. 2 most common issues, I would say, one is worry or stress. The second one is noise while they're sleeping. So if we take a look at worry or stress, when we are stressed, our body produces a hormone called cortisol, which is a stress hormone. And if we look at how cortisol fluctuates throughout the day, looking at this diagram here, starting from the left, this is a patient who's just woken up. So you have a rapid rise in your cortisol just after you wake up. And then over the course of the day, those cortisol levels slowly decrease until the evening where you have the steepest drop in your cortisol levels down to the lowest point, which happens right after you fall asleep. And then slowly towards the second half of the night, the cortisol levels start to go up again until you wake up, you start this cycle. Now, studies have shown that higher cortisol levels in the evening are associated with difficulties with falling asleep and staying asleep. So if we're having stressful thoughts or worrying at night, our cortisol levels are elevated, and that makes it a bit of a challenge to get a good night's sleep. So how do we deal with that? Now, there are patients or lots of people that we know that have had poor sleep for so long that even the thought of going into a bedroom to sleep is a stressor in of itself. And the way that you can try to disrupt or eliminate that negative association with the bedroom is to impose strict boundaries on the bedroom. The bedroom should be for sleeping and for intimacy. Now, I've had patients who have expressed their concern that now working from home, the only place they can work is their bedroom. And what I would recommend for that is even within your bedroom, trying to designate a small space that is your workspace, that's separate from the bed. And when you're finished with work, create a physical barrier, right? Even if it means putting a blanket over your workspace, it signals to your brain that these two spaces, your workspace and your bed, are separate from each other. The second question I get asked is reading in bed. Is that okay to do? Now, these recommendations I'm giving, these are guidelines. Nothing here is set in stone. So the expectation from my end is that these guidelines will be taken and fit to, the realities of your life. So if reading is something that is relaxing for you, then I would say go for it, but with a few caveats. One is that if you are going to read in bed, it should be something that's consistent. So it becomes a cue for your brain that that is part of your wind down to fall asleep. It should not be on a device because we don't want that light suppressing the melatonin that's needed for you to fall asleep. And you want to try to avoid triggering content like COVID, politics, finance, even things that are positive but highly engaging and stimulating. You're trying to get your brain to wind down. So for patients who have general worries, general stresses at night, what I typically say is, one of the best ways to curb worry is by taking some form of action. And the action that we typically recommend is journaling. Setting aside a specific time, typically is 1.5 to 2 hours before bed, where you sit down and you take the time to acknowledge those stresses, to process those worries, and to write it down on paper. It signals to your brain that you're taking an action. Even if you don't have a solution for those worries or stresses, you're taking an action by writing it down. What you're also doing is transferring those thoughts from your brain to a piece of paper. So now you're providing your brain with a clean slate that you can now take control over and fill with positive thoughts, be it small things, small accomplishments that happened during the day, things that you may be grateful for, but you're now trying to set your mind up for a peaceful transition to sleep. So what happens if you've done all of this and you're still waking up 2 a.m., thoughts are racing? We talked about the cooling techniques that can be done. There are also the use of apps, having that app with white noise, which can be soothing rainfall, soothing rivers, waters, whatever is comforting for you, sleep stories, anything to try to replace those racing thoughts can be helpful. Meditation is also very good. And meditation is not just within this moment when you wake up at night, but meditation in general. One of the principles of meditation is to help you reduce emotional impulsivity. So with meditation, you gain a skill where you are faced with a stressful situation and you learn to stop, take a breath, compartmentalize things so that you could respond in a thoughtful, balanced manner instead of with raw, impulsive emotion. And that can be very helpful at night when you wake up at 2 a.m. to be able to stop, take a breath, and gain that skill of being able to compartmentalize and let your brain know that it's not appropriate to be having these thoughts at 2 o'clock in the morning. This is something that does not happen overnight. It takes practice, it takes patience, but it is definitely a skill that I would recommend looking into if you're having any sort of trouble with sleep. So physical things to think about for a patient who's waking up at night, or physiologic things, I should say. Nasal congestion. If a patient is waking up, their nose is blocked, things that they can try: getting a humidifier in the bedroom, saline salt water rinses to be done about 1 or 2 hours before bed as well can be helpful. Inclining the head of the bed so that you're not lying flat where blood can rush to the tissues in your nose and get them all swollen can be helpful. Now, if a patient is still having congestion despite this, then they should seek out their physician to see if medications may be needed, or in some cases, if a procedure may be needed to help relieve that blockage or congestion they're having. Reflux. So reflux, again, for patients who are waking up with some discomfort, and sometimes they're not even aware that that's what's waking them up. Reflux pretty much is regurgitation of acid from the stomach going into the esophagus, and ways to avoid that is to limit eating anything within 3 hours of going to bed. If you have to eat, try to eat, I would say liquids are better than solids. So if you're having a light soup, that's better than, having that slice of chocolate cake just before you go to bed. Avoid fatty foods, things that are high in sugar. These will be helpful to prevent these symptoms of reflux. And again, if it continues, seeking consultation from their physician to see if anything further needs to be done. Restless legs. So this is another finding that, we see a lot in our sleep clinic. And patients, again, may not realize that this is happening when they're sleeping at night. Their legs are moving and causing them to wake up at night. Some clues to it would be a patient who says in the evening or night, they can't seem to get comfortable when they sit down. Their legs feel like they're cramping. There's a sensation almost of insects crawling under their skin. They have to get up. They have to keep moving to get rid of that sensation. If that's happening, they should definitely see their physician to see if their iron levels are low and to see what further treatments may be offered to them at that point. So the second issue that I think we've all encountered is noise in the bedroom in the form of snoring. And what's interesting, why I wanted to talk about this here, is that I do have patients where they're not snoring, but it's their partner that's snoring. And they're coming to me to figure out ways to help them sleep despite their partner snoring. And, I think it's important to counsel that patient to say that with, snoring within a relationship is not one person's problem. It's both, because it's not just the health of the person who's sleep deprived that is a concern. It's the potential health of their partner that's snoring as well. And a lot of people believe that snoring and sleep apnea are two separate entities, but it's all part of one continuous spectrum. So snoring may be an indication that there is actually sleep apnea that's happening, or they may progress to that if certain lifestyle changes or modifications aren't made at that particular point in time. We're living in an era, we're trying to move into an era where healthcare is no longer reactive, where we're just reacting to a disease that comes up, we're trying to treat it. Trying to move into a space where healthcare becomes more proactive, where we're trying to prevent disease. Snoring is a perfect example where, for all of us as healthcare providers, we can step in at an early stage to help prevent disease before it happens. Now, you would still have that patient who has a partner that's snoring and they want some advice. What can they do? And typically, I would say, one, trying to go to bed first. If you can get a head start and get into bed first, get into your level of deep sleep before your partner comes into bed, there may be a chance that the snoring may not disrupt your sleep at that point in time. Headphones. So traditional headphones, not comfortable. There are headband headphones that can be worn that are padded around the ears, so it doesn't cause discomfort there. Again, it should be white noise, nothing that's stimulating at all. And what I would caution here is the volume. Make sure the volume isn't too loud because you don't want to run the risk of incurring noise-induced hearing loss or tinnitus. Trying to change the position of the bed, inclining the head of the bed may help your partner who is snoring. Having your partner turn onto their side may be helpful as well, things that they can try. And ultimately, if nothing else is working, separate bedrooms. Now, a lot of patients, when this comes up, they're hesitant, all right, to move into separate bedrooms because there is a fear of a loss of intimacy by doing this. But studies have shown that in a situation where you have one partner that's sleep deprived and the other partner, because of another partner snoring, marital satisfaction actually goes up after they've separated their bedroom space. And that's for two reasons. One is the person who's sleep deprived no longer has any energy or motivation to actually be engaged in that relationship in a meaningful manner. And development of feelings of resentment or anger towards your partner because you don't feel like your sleep is being valued can occur over time. And those factors are way more damaging or harmful to our relationship than a few hours overnight of physical distance. So if it's come to that point, I would, counsel them to at least have the conversation about it in an honest, non-judgmental way as a potential option for them moving forward. So sleep aids, natural sleep aids. There are a lot of them, and unfortunately, a lot of them, there isn't enough or any medical literature for us to be able to make any definitive comments on. But I will talk about two of sleep aids that are out there right now. One, melatonin. It's the most popular sleep aid that we have, and we know that it's a hormone within our body that is synthesized from serotonin, and it's synthesized in a part of our brain known as the pineal gland. And typically, as we talked about, the triggers, darkness, decrease in temperature, can signal sleepiness. There was a systematic review that came out earlier this year trying to look at the effect of melatonin on sleep quality. And they looked at this in adults over the age of 18 who were not pregnant or lactating. And the sleep quality, the articles they chose were articles that looked at sleep quality using the Pittsburgh Sleep Quality Index. Any articles showing using melatonin, prolonged release melatonin were included. The dose ranged from 2 milligrams to 10 milligrams. And what they found overall was that melatonin did improve sleep quality. There was no difference found, significant difference found with regards to the dosage that was given, and there was no significant difference when it came to the age of the patient that was taking the melatonin. They did find that patients who had respiratory disorders, sleep disorders, or any metabolic disorders, they tended to do better or feel better using melatonin compared to other patients who had other disorders such as mental health or neurodegenerative disorders. What I tell patients when it comes to melatonin, things to remember is that melatonin is not hypnotic. It's not a sedative. It's not a pill that you take to fall asleep, to just go to sleep right away. That's not its role. Melatonin is a chronobiotic, meaning that taking a melatonin supplement is there for you to give your system a nudge that, hey, you know what, it's getting dark, it's time to sleep. So melatonin is best used in conjunction with all of these sleep hygiene tips that we spoke about. So if you have a patient who's taking melatonin, but upon further questioning, realize, well, they're still on their phone up until midnight, 1 a.m., they may not get the beneficial effects that melatonin potentially could have for them. The other thing is that melatonin, like most of these other natural supplements, are not FDA regulated, meaning that the dose that's on the label may not be equivalent to the dose that's in the actual tablet that you're taking. And gummies are infamous for this in terms of being inaccurate. So I typically would tell my patients, if you are going to try it, avoid gummies if you can. Use a tablet form and use one that's a pure melatonin, so one that does not have the herbal extracts in it, because that in of itself makes it even more questionable how much of that melatonin you're actually taking. Now, the other sleep aid I wanted to touch upon is cannabis. Now, cannabis was recently legalized in 2018 and put out to market. And as a result of that, medical research has been scrambling pretty much to try to catch up to the needs and questions that our patients have when it comes to cannabis and sleep. And you'll see that a lot of these studies right now, because it's in its early stages, are showing conflicting results. So if we talk about cannabis here for a bit, cannabis is a flower, a plant that has over 100 different cannabinoids, and cannabinoids are the active compounds that are found within cannabis. These cannabinoids can work within what we call our endocannabinoid system. And our endocannabinoid system is a system within our body that has receptors that can accept plant-based cannabinoids like cannabis, but it also accepts cannabinoids that our own body produces itself. The two main receptors we have in our body are CB1 and CB2. And when we look at these active compounds that are found in cannabis, the two most well-researched, but the two most researched thus far are THC and CBD. So THC is an active compound within cannabis, which is known to be the psychoactive component of cannabis. So it's the component that gives you that high. THC typically binds to the CB1 receptors in our endocannabinoid system, and it has a biphasic effect. So depending on whether you have a low dose or a high dose, it can have different effects, which makes things even more confusing. The other researched active compound or cannabinoid is CBD. CBD acts on our CB2 receptors. This is not intoxicating, and sometimes it's shown to counter the effects of THC. So far, the studies are showing that CBD has what we call anxiolytic effects. So it's very helpful in terms of reducing anxiety, and there may be other potential therapeutic effects as well. But again, this is all new research that's with ongoing studies happening as we speak. So there was a systematic review that just came out, published about 2 months or so ago, that tried to look at cannabis and its effect on impaired sleep. Now, within this systematic review, their population were primarily patients who have chronic non-cancer pain, so pain like fibromyalgia, carpal tunnel syndrome, for example. And with these patients, or when you look at these studies that they had done, these studies were primarily randomized control trials where one group would have a cannabinoid or using a cannabinoid of any form compared to a group that did not have a cannabinoid or was not using one. The majority of these studies showed the cannabinoid in an oral formulation. There was only one study that showed the cannabinoid as an inhaled form. And the sleep measure that they looked at within these articles or converted to was a visual analog scale. Which is basically 10 being worst sleep ever, 0 to 1, great sleep. What they found was that there were small improvements that they noted with cannabis when it comes to sleep quality. So 1 out of every 13 patients basically reported some improvement in sleep quality. And when it came to sleep disturbance, they found that there was a small improvement as well. So 1 out of every 5 patients, but 1 out of every 5 patients were the patients that had chronic non-cancer pain. Patients who were experiencing cancer pain, there was a smaller effect seen there. In terms of side effects that were noted, the major side effect is dizziness. So 1 out of every 3 patients did report feeling dizzy, and the risk of dizziness did increase over time. So if a patient used cannabis for longer, in this review, longer than 3 months, the risk of feeling dizzy did go up. Other side effects that were reported were nausea, fatigue, somnolence, and dry mouth. So, there were certain limitations with this review. It's hard to generalize because the majority of the population reviewed here were patients who have chronic pain. The studies as well, majority, if not all, except one, were looking at cannabinoids in its oral form versus the inhaled. And the sleep measure that was used was quite vague. So, there are limitations that are here, but overall it's reassuring to see that there are these types of studies that are coming out to help us guide our patients when they ask us questions about the potential benefits of cannabis for sleep. So there are lots of questions that still remain. One is, what is the short-term versus long-term impact on sleep? Short-term, we're seeing that cannabis reduces sleep latency. You fall asleep faster. There are many studies coming out now showing a reduction in REM sleep as well, but the long-term impact, still needs to be studied. The next question, is there a risk for dependence? And if there is, what are the risk factors? I think this is a very important question. Studies so far looking at heavy cannabis users and what their withdrawal symptoms are. Primary symptoms are disruption to their sleep. So sleep disruption, very vivid dreams, and these symptoms can continue for up to 45 days after they've stopped. So oftentimes a lot of these patients end up going back to using cannabis because their sleep is just too disruptive for them to keep going without it. The other question to look at is how does cannabis impact our patients with sleep apnea? And this comes back to the endotypes of sleep apnea. When we treat a patient with oral appliance therapy or certain types of surgeries, we are treating the collapsibility portion of the airway. But we do know there are other factors, the arousal threshold, the loop gain of that patient. What is their upper airway dilatory response? There have been animal studies that have looked at mouse models and they've administered THC, and they found a reduction in apneic events by improving the upper airway dilator response. There was a clinical trial done in humans where they used a synthetic form of THC called dronabinol, and pretty much it did show that patients who have sleep apnea, there was a reduction in their apneic events as well too. So a lot of promising research that is ongoing. So I think that we do need to continue to follow to see what further developments occur and how can these products potentially help our patients moving forward. Sleep trackers. So again, consumer sleep technology is evolving so fast. It's really hard for us as sleep professionals to keep on top of it all. What I would say is so far, sleep trackers are great and are getting much better at looking at sleep-wake patterns. When it comes to differentiating stages of sleep, I would say that they can be used as a rough guide at most at this point, but the accuracy just isn't there yet. I think sleep trackers have advantages. One advantage is that a patient can track their sleep for more than one night. They can establish sleep patterns that we cannot in doing a one night in lab sleep study. And by doing this, you're empowering that patient to actually work on improving their own sleep hygiene through tracking their differences in patterns based on their habits. The second reason I think it's advantageous is for a patient who may be home alone. They have no idea that they're snoring, that their oxygen levels are going down, and having a sleep tracker can be that trigger that would lead that patient to speak to their physician, about getting help for their sleep. Finally, insomnia. If you have a patient that is having difficulty with sleep more than three nights a week for more than 3 months, that patient has chronic insomnia, be it initiation insomnia, where they're having difficulty falling asleep, or maintenance insomnia, where they're having difficulty staying asleep. And in these situations, sleep hygiene is not enough. They need something more. The American Academy of Sleep Medicine have put out guidelines basically stating that cognitive behavioral therapy should be recommended, and is a strong recommendation for patients who are experiencing insomnia. And cognitive behavioral therapy is provided by professionals who are certified in what we call CBT. And this is CBT specifically for insomnia. And this has pretty much 5 components to it. First component is stimulus control. We spoke about that in terms of getting out of bed if you're not able to sleep. And I may not have actually addressed this here today, but what happens when you wake up at night, if you are worried and you are stressed and anxious, you should not stay in bed. If you're in there for about 10 minutes or 15 minutes, it's time to remove yourself from the bedroom. Maintain that association, the boundaries of the bedroom being for sleep. It's not for fretting or worrying. So remove yourself from the bedroom, go to another room, do something that's not stimulating until you feel drowsy again, and then you come back to the bedroom. A key component of that, I would say, is that if, for example, you end up being drowsy at 5 a.m., you come back into bed at 5, your wake-up time is 7, maintain that wake-up time so that day will be painful, but you are keeping that sleep drive that you have harnessed for the following night, so that hopefully you've broken that cycle and you can start resuming a good night's sleep again. Next components of CBT, sleep restriction. Sleep restriction is where you're really trying to get good quality sleep for the number of hours you're in bed. And CBT is very helpful for giving strategies that can allow for this type of restriction that's needed. Sleep hygiene, we spoke about today. Relaxation, lots of relaxation techniques that are discussed in CBT, including meditation, abdominal breathing, progressive muscle relaxation. Again, I'm not certified in CBT. We do refer out, but this is just an overall sense of the principles involved in CBT. The last component is CBT itself. If you have a patient who has been having trouble sleeping for a very long time, inevitably they have developed certain behaviors, beliefs, and attitudes about sleep that is negative and counterproductive. The purpose of CBT is to help that patient unlearn all of those behaviors and retrain them and empower them with strategies that can move them forward for better sleep. It has been shown in the short term that CBT is as effective as sleeping pills. It will take longer because the patient has to learn and learn these strategies. But overall, in the long term, CBT is more effective than a sleeping pill, because once you come off of a sleeping pill, you're back at ground zero where you started 5-10 years ago. But with CBT, you have those strategies for life. So I would just say, at the end of all of this, if you have a patient who has been having poor sleep for 10 to 15 years and they ask you, is there any hope for me? There is. They should, if they try these techniques, these hygiene tips, and it's not working, they should reach out to their physician to see what further help they can get. Thank you.